According to Ivy and Ivy, approximately 85% of communication is nonverbal. This includes facial expressions, proxemics, kinesics, and paralanguage. In other words, communication that doesn't use words. It's important to note that nonverbal communication occurs outside of awareness and is difficult to fake. In this respect, for human services professionals, developing awareness of nonverbal cues is extremely valuable to help interpret meaning in spite of what's being said. Kinesics refers to body movement, position, and posture. An example is interpreting a person who sits with arms and legs crossed during a conversation to be closed off and unreceptive. Proxemics describes use of personal physical distance, also known as personal space. Hayes gives as an example the concept of keeping arm's length when communicating with another as comfortable for most European Americans. However, in some Arabic cultures, communicating from arm's length would be considered unfriendly, since an acceptable distance in that culture is roughly 18 inches. Paralanguage is described as verbal cues other than words. The set of non-phonemic properties of speech, such as speaking tempo, vocal pitch, and intonational contours that can be used to communicate attitudes or other shades of meaning. Emotional expression is a function of socialization, and the way in which emotions are expressed is linked directly to cultural norms and acceptable group practices. Dominant culture norms view the external expression of emotion to indicate mental health. In non-Western cultures, outward expression of emotion may be stigmatizing and indicate mental health issues. It's important to adhere to a practice of interpreting a client's emotional expression from within the context of her or his culture, rather than evaluating from a Eurocentric perspective and determining that pathology exists.